We're getting close to overall about 90% of children with ALL being cured with chemotherapy alone, standard approaches. But the difficulty is that there are a proportion of patients who will relapse, and if we look at the characteristics of patients who relapse, we can select out those that have higher risk and for whom unfortunately outcomes remain poor despite all the way that we've intensified treatments and delivering transplants and all the rest of that sort of aspect of their management. So there are sort of key features of a patient who's had a relapse that we can pick out to know that they're going to be a poor player going forward. And they're perhaps the people who they hit the ceilings of toxicity because we throw everything that we can at them, and overall their survival long term will be way less than 50%, so about 30 to 20%. So if we look at children who relapse early, who relapse in the bone marrow early, then we know that their outcome overall is very, very poor with standard approaches. But the field is shifting, and some of the aspects that were discussed here in terms of new immunotherapies, including antibody-based treatments like inotuzumab and blinatumomab, these are providing a real benefit, mainly to get people to their transplant. But it means that they get there in better shape, and then maybe as a result of that, then the outcomes are much better because you're not getting toxicity on your way to your transplant. So I think there really is excitement that will make a big difference.